At a time, we're going to cover Candida, and Candida is a very extensive topic. In our clinic, we would address candidiasis or systemic Candida infections in both an allopathic and integrative fashion. Our medical director would prescribe oral antifungals or IV antifungal medications. We would also incorporate the use of different IV therapies such as sodium bicarbonate IVs, hydrogen peroxide, major autohemotherapy with ozone, glutathione, alpha-lipoic acid, and phosphatidylcholine IVs. For the external, we would incorporate our ozone sauna, which is a steam chamber. And depending on if it's an issue where the Candida is localized to a specific area, perhaps the intestines, we could use colon insufflation with ozone or vaginal insufflation with ozone. We would use oral supplementation as well, primarily oil of oregano, a product called Candida Digest, acrylic acid, and another product called Mycoplex. And those are all natural formulations that can help. If a person needed binders because the Candida was dying off too fast and causing a Herxheimer reaction, we would use activated charcoal, zeolite, orally by mouth, separate from their supplements, taken on an empty stomach. So those are the primary treatment methods. When it came to the patients at the office, we would always look at the symptomology behind it, as well as standardized testing. The symptoms of Candida can be brain fog or poor comprehension, systemic fatigue. We're talking like massive fatigue, sugar cravings, bloating, gas, constipation, sometimes diarrhea. Not everybody's the same in that respect. Some people fall into one category or the other, but digestive distress, bloating especially. Recurring infections are another issue with systemic Candida. The infections can be yeast infections or prostatitis. It can also be recurring sinus infections or urinary tract infections. And urinary tract infections I thought were pretty interesting because sometimes women would come in and they would have to go through antibiotic therapy several times a year because they'd have chronic UTIs or recurring UTIs. Sometimes they would have UTI symptoms and they would go to the doctor and they would test negative for infection. And what we found was that it was actually the Candida that was causing the similar symptoms or almost the exact same symptoms as a bacterial infection would for the urinary tract, but it was actually the Candida. Sometimes doctors know to look for those things, sometimes they do not. The things that can lead to systemic Candida overgrowth are poor dietary choices, always, of course, immunocompromised individuals, people who are going through cancer treatment or HIV treatment, or perhaps even are organ recipients because they are on immunosuppressive therapy. In your average person who's not suffering from an autoimmune disease or something severe, you can have systemic Candida and not know it. You can have just some of the symptoms. And for those individuals, besides the clinical symptoms, we would look at blood tests. The Candida antibody blood test through a blood draw is sometimes helpful. Sometimes we would get that back and it would show very high levels of antibodies present. Antibodies are interesting because when you get Candida or any kind of infection, your immune system responds through antibody production. Just because the person has antibodies present doesn't mean that they have a current infection. Antibody levels can stay elevated for quite some time afterwards, so that one's a little tricky, but we would still use it as a baseline and also post-treatment. Organic acids testing is great for all things gut related. That does show deficiencies in several areas, but also shows that Candida is present. So we would use organic acids or OAT testing for most people. We would also look at sometimes stool culture and live blood analysis. Live blood analysis is very simple and easy. It can be done right in the office. You take a drop of a person's blood, look at it under the microscope, and see if there are any fungal spores present. So we would use not only the symptoms that they were experiencing as far as determining what course of treatment to take or what they should undergo, but we'd also use all those standardized tests. we'd get a baseline pre-treatment, we'd get a post-test done so we could see the progress that's been made. When people were going through major systemic candidiasis, we would have to put them on intense IV programs along with perhaps prescription medications. But a lot of people coming to see us didn't really want to go through the prescription medication route if they didn't have to, or they may have already been through it and it was ineffective because it wasn't done with all of the integrative treatments at the same time. One thing you have to remember about Candida is it's an opportunistic pathogen that is highly mutagenic and extremely aggressive. It can go through periods of dormancy where if you are decreasing the amount of sugar in your diet, the Candida can simply go into hibernation. And once your sugar level increases in your diet again, it just comes right back to activity. Starving Candida is important, but it's not the way to kill it. Primarily, we would use the sodium bicarbonate IVs, hydrogen peroxide, and those would be the main oxidizing therapies. Oxidation is the key to the treatment because it actually damages the outer membrane of the Candida so that the spores die. As far as die-off is concerned, when we were running people through the program, there were high amounts of die-off usually in the beginning, and it would taper as we went along. But we would use the antioxidants, glutathione and phosphatidylcholine, to help us as internal binders along with the oral binders that I mentioned earlier. Because Candida is so mutagenic and tricky, we would have to get in there and we'd have to hit it hard for sometimes 2 weeks, sometimes longer. But once we were done and the Candida was cleared and everything was back to normal, back to baseline, then we would actually reestablish good intestinal health through probiotics and prebiotics and maintain, of course, we'd always want the patient to maintain a good healthy diet and exercise routine and lifestyle. Candida can cause so many problems and symptoms that it will mimic several other things. And as a skincare company, if you're working on your skin and you're using our products and things aren't clearing the way that they should be, the underlying cause is not being addressed. And coming from an integrative medical perspective, I think it's important to give you as much information as we possibly can because we want you to be successful in using our products. Our products are great, but they may have limits. And when it comes to Candida, you can't kill Candida with ozonized oils. Candida specifically needs exposure to ozone gas for periods of 20 to 30 minutes in order to be effective. When when ozone goes into oils, it's not in a strong enough concentration or in a gaseous form anymore to where it will actually oxidize those spores. If you are using ozone gas directly, like say in the ozone sauna, you're going to sit in the sauna for 20-30 minutes. It's actually going to be exposed to all of your skin. The gas will be exposed for over 20 to 30 minutes, and so you're going to have an effective rate of die-off from the Candida topically. That's not going to work in the tissues. It's not going to work in the blood. If the patient was experiencing recurring vaginal yeast infections, we would do vaginal insufflation with ozone, where the ozone is bubbled continuously through the vaginal cavity for 15 to 20 minutes, and in which case we'd have good time exposure and concentration exposure to the Candida spores. If it's in the large intestine, we would use colon insufflation, where we infuse ozone gas into the colon and the gas is retained for 30 minutes. That period of time gives plenty of exposure for the Candida present there to die off. So it's very effective in local treatments, as well as if it's a man, it's helpful for the prostate. If it's a woman, it's helpful for the pelvic floor and also the ovaries and uterus. Biofilms are a major factor in most types of microbial infections, Candida notwithstanding. Ozone, hydrogen peroxide, and bicarb are all biofilm disruptors. Once the biofilm has been stripped, then the immune system can then work and the other agents present can destroy the Candida as well. Biofilm itself, the intestines produce a large amount of mucus to keep themselves moist and allow for all of the material to flow through smoothly. During systemic Candida or a Candida infection in the gut, the amount of film produced or mucus produced there increases exponentially. Good sources of fiber will help to scrape the mucosal lining, and that's, ozone gas going into the colon is only going to work in the descending and transverse colon, the large intestine. It's not going to get into the small intestine. So you really want to make sure that you're working from the top down with supplementation or medication. You want to work from the bottom up if needed, from external to internal with the sauna or even hydrogen peroxide baths. And then you want to work from the inside out with the either antifungal medications or IV therapies. So basically attacking the Candida on all fronts. Don't give it a place to hide. It is really good at hiding. And you want to get in there, hit it hard, and make sure that the treatment's effective. Once the treatment's effective, we had patients years later that we hadn't seen that would just continue to rave about the treatment plan. They would send in friends, they'd send in family, and that's kind of how we kept up with them when we weren't able to see them in person. One woman in particular, it was a really funny story. She would always carry a bag of candy in her purse because her sugar cravings were horrible. And I gave her a really hard time about that the first week of the treatment because she still had the candy and she was still snacking on candy while she was getting treatment done, and it just kind of bugged me. I just didn't want her to do that. Well, my wife and I, years later, are shopping, and all of a sudden this man and woman approach us, and the woman looks familiar, but I can't quite place her, and I don't know the man at all. The woman walks up and she says, "Hi, Chris, how you doing? It's good to see you." And I said, "Well, it's nice to see you too." And she just could tell by the look on my face that I just couldn't place her. She said, "You don't remember me, do you?" And I said, "Well, you look familiar, but I can't remember you." And she said, "Maybe this will help." She opened up her purse and showed me the inside. And I thought that was just strange because that's just not a normal thing to do. And I looked up and she was smiling, and she said, "There's no candy in there." And as soon as she said there was no candy in there, right away I knew exactly who she was. And she was so happy. She said she hasn't actually had any sweet cravings in years. And I think this was about 3 years after her program was done. So that's pretty darn good. And her husband, I'd never met him before. He thanked me. He said she's been doing great ever since. Her health has been fantastic. It was just kind of one of those out of the blue experiences that I just will never forget because of the candy, or in this case, the lack thereof now. Anyways, I hope you enjoyed this video. If you have questions or comments, please comment on the video, follow us on social. We love interaction. We want to be of service to the community. We want to help you. We want you to use our products and for our products to be successful for you. And in order to be able to do that, we want to try to help you understand the full picture of what's going on in your body, or what could be going on in your body. And after 25 years of experience, we have a few things that we'd like to tell you about. And so look for follow-up videos. Like I said, I hope you enjoyed this one, and I hope you have a great day.